41 million Americans wear contact lenses, and 99% of those users do something that could cause an eye infection. Most don't think twice before sleeping in their lenses, or using contact solution, or even swimming in them.
But a new study shows you should. Melanie, those mistakes can really lead to some serious infections, too.
You know, guys, 1 in 5 contact lens-related eye infections result in serious damage. We're talking scarred corneas, reduced vision, or the need for corneal transplant. Or in the case that I'm about to tell you about, a corneal ulcer that almost cost a local man his sight.
I like to think that I'm, not a wimpy guy, but it was like a 10 out of 10 on the pain scale. I never experienced anything like
Chris Brewer has worn glasses since he was 9 years old. He got his first pair of contacts at 12. It wasn't until August that he had his first scare, and it was beyond eye-opening.
I went to the emergency room. They sent me to another eye doctor, and the eye doctor said, "You're probably going to lose your vision in your eye."
Brewer's eyes were already irritated, and he didn't take out his lenses and then made a big mistake. He went to a water park, jumped in, wearing his contacts. Dr. Ravi Patel at Florida Eye Specialist likely saved his sight.
Most likely he had a scratch on his eye, and then he put his contact lens in, and then he went swimming, and that really irritated his eye and got the infection in his eye.
It wasn't just any infection. It was a corneal ulcer, and it was serious.
Within an hour or two, my eye was in such horrible pain that I couldn't believe it. Within another hour, I had a white spot on my eye.
A CDC study looked at 1,100 cases of eye infections from 2005 to 2015. 1 in 5 patients had serious eye injuries, and more than 10% had to go to the ER. 1 out of 4 were linked to easily preventable risk factors, like wearing contacts too long or while you sleep, not changing out solutions, or swimming in your contacts.
I think people just overlook it, but when you do get a serious infection or a problem, that's when you really start changing your habits and realizing, wow, I've been putting myself at risk this long, I just got lucky.
Dr. Patel says sometimes your contacts can mask the pain, and that can just make a problem worse.
And patients will say, well, that's why I kept putting my contact lens in, because it felt better in my eye, not understanding that that's what could have led to an infection or a serious threatening event for their eye.
Brewer learned the hard way, and he's clearly motivated.
And it's become a habit. Good habit. You can have bad habits and you can have good habits. This has become a good habit where I'm constantly making sure I take care of my eyes, making sure that I do the right thing, because I'll tell you what, a little bit of prevention could have avoided that whole mess.
Dr. Patel says that if you feel irritation in your eye and it does not resolve in a day or so, that is when it's time to call the doctor. Bruce, Jen, back to you.